Okay. Today we will going to see the jaundice. It is also known as icterus. It is also known as icterus. It is a disorder caused by abnormally high levels of bile pigments, that is the bilirubin, biliverdin in the bloodstream. Okay. High levels of the bile pigments. Okay. The elevated level of bilirubin is called as hyperbilirubinemia. Hyperbilirubinemia means high levels of bilirubin in the blood. Depending upon the pathophysiology, jaundice may occur due to one or more of the following mechanism. We will see the mechanism. Due to increased bilirubin production or decreased hepatic uptake or decreased hepatic conjugation or decreased excretion of bilirubin into the bile, either or. Okay, due to these are the mechanism we will see in detail afterwards, but the following due to these mechanism the jaundice may appear increased bilirubin in production, decreased hepatic uptake, decreased hepatic conjugation, decreased excretion of bilirubin into the blood. There may be any obstruction is there. We will be going to see later. Now see the types of the jaundice. There are three types. Hemolytic jaundice, also called as pre-hepatic jaundice, hepatocellular jaundice, that is also called as hepatic jaundice, and obstructive jaundice. Third one, obstructive jaundice, that is also called as post-hepatic jaundice. Okay. So three types, that is pre-hepatic jaundice, hepatic jaundice, and post-hepatic jaundice. We will see one by one. Now, first one, that is the pre-hepatic jaundice. Okay. This type of the jaundice occurs due to breakdown or degradation of hemoglobin, which leads into increased production of bilirubin. That is called as a hemolytic jaundice. This is also called as a hemolytic jaundice. Okay. Hemolytic, lysis, breakdown of the hemoglobin. So it is called as a hemolytic jaundice, or it is also called as a pre-hepatic jaundice. What are the causes of this hemolytic jaundice or pre-hepatic jaundice? This type occurs means before going to the, without damaging to the liver, that is pre-hepatic. Hemolytic jaundice means here what is the cause? Mainly breakdown of hemoglobin. Okay, breakdown of hemoglobin. That's why the name is pre-hepatic jaundice, not in the liver. Okay, due to breakdown of the hemoglobin. Now, what are the causes? Due to malaria, sickle cell crisis, spherocytes. Spherocytes means what? Actually, the erythrocytes are, red blood cells are biconvex, isn't it? Which shape? Biconcave in shape. But what here? They are spherical in shape. That's why it is called as a spherocytosis. This is called as a spherocytosis. That's why they are breakdown. Hemolytic anemias to some degree. Due to this change in the shape, these spherocytes are found in all hemolytic anemias. Due to this shape only, they will easily break down, isn't it? So this name is spherocytosis. Okay. Next one, thalassemia. Thalassemia means what? It is a blood disorder characterized by low oxygen carrying capacity of the hemoglobin. Okay. And next one, that is the glucose 6-phosphate dehydrogenase deficiency. This is the which deficiency? Glucose 6-phosphate dehydrogenase. This type of enzyme is deficient in our blood. That's why because of this it causes the hemolysis. Because of this deficiency it causes the hemolysis. That's why this is the major cause in this. Drug or other toxins, due to the drugs means medicines, other type of the medicines or other toxins. Autoimmune disorders, due to the autoimmune disorders, these are the causes of the pre-hepatic jaundice, which are those malaria, sickle cell crisis. Sickle cell means the RBCs are sickle shaped, isn't it? Due to that, they will break down easily. And this is the same spherocytosis. Means in this, what happened? Mute yourself. Spherocytosis, in this also, the erythrocytes are in which shape? In which shape? Spherical. But normally these are biconcave in shape, biconcave in shape. Okay. Due to thalassemia. Thalassemia means what? Thalassemia means what? Low oxygen carrying capacity of the hemoglobin. Okay. And due to the glucose 6 phosphate dehydrogenase deficiency. This is the enzyme. Due to this deficiency of this enzyme causes the hemolysis. And also due to drugs and other toxin, and also due to the autoimmune disorders. These are all about the causes of the pre-hepatic jaundice. Now we will going to see the hepatocellular jaundice. Means it is also called as a hepatic jaundice. Means it is actually the damage to the liver cells or dysfunctioning of the liver, or we can call it as a dysfunctioning of the liver. So that's why it is called as a hepatitis, inflammation of liver, hepatic cells, inflammation of hepatic cells. Hepatic cells, that is the liver, it is present in the liver. So in the liver, that's why it is called as a hepatic jaundice. Hepatocellular jaundice. The cells are damaged, dysfunctioning. So what are the causes due to the hepatitis? Means only the inflammation of the liver, cirrhosis. Okay. And drugs or other toxins also are the causes. Another one cause, that is the Crigler-Najjar syndrome. Crigler-Najjar syndrome means what is there in this? The severe condition characterized by high levels of this bilirubin. This is called as hyperbilirubinemia. Hyperbilirubinemia. When in our blood there is more bilirubin present, that time this disease is, that syndrome is called as a Crigler-Najjar syndrome. Okay. Next one, the Gibbert syndrome. This is the genetic disorder, liver disorder. In that, what happens? The ability to process the bilirubin is affected. That's why it is called as a Gibbert syndrome. It is a genetic liver disorder. Okay. Next one, cancer. These are the causes of the hepatocellular jaundice or hepatic jaundice, which are those due to all about the dysfunctioning of the liver cells. Okay, dysfunctioning of the liver. Okay, hepatitis, cirrhosis, due to drugs or other toxin, these causes the inflammation of the liver. This is due to the hyperbilirubinemia in the blood, and this is the liver disorder, Gibbert syndrome. Gilbert syndrome. This is the liver disorder and also due to the cancer. Next one, the obstructive jaundice. Obstructive jaundice or post-hepatic jaundice. This type of the jaundice occurs as a result of an obstruction in the bile duct. Obstruction in the bile duct. There is a duct from liver to the intestine, from the liver to the gallbladder, okay, and small intestine. There is a bile duct is there. If there is any obstruction in this duct, then it causes the post-hepatic jaundice. Whatever the secrete, the biles, that should be come into the gallbladder storage of the bile, and it will come into the small intestine. By which duct? By the bile duct. Okay. So which prevents the bilirubin from leaving the liver. So what happens? If there is any obstruction, the bile will not come into the gallbladder. The bile will not come into the small intestine. So this is called as a obstructive jaundice or post-hepatic jaundice. What are the causes? Due to the stones, gallstones in the bile duct, due to the cancer, pancreatic or gallbladder or bile duct carcinoma, structures of the bile duct. Okay, due to the cancer, which type? Pancreatic or gallbladder. Congenital malformations. Sometimes what happen? By birth only, there is a obstruction, isn't it? Next one, pancreatitis, inflammation of the pancreas. Parasites, due to parasites. In pregnancy also, sometimes it will press the duct. Due to that, this is the cause. Newborn jaundice. Sometime what happen? By birth only, the jaundice will take place to the newborn. Due to what? Due to this condition. These are the causes of the post-hepatic jaundice. Which are those? Due to gallstones, cancer, congenital malformation, congenital by birth only, pancreatitis, due to pregnancy, due to parasites, and in the newborn jaundice due to this obstruction in the bile duct. Due to this, the newborn causes the jaundice. Now symptoms. What are the symptoms are there? Eye, skin, everything. These are the yellowish in color. Whatever the white area of the eye is there, that sclera will be yellowish in color. Skin also in yellowish color. Okay, because the coloration of the bilirubin biliverdin, these pigments are yellow in color. Yellowish coloration of the skin and mucous membrane. Pale stool, dark urine, dark yellow coloration of the urine. Pruritus means itching. Okay, everywhere itching is there. Fatigue, that is the weakness. Abdominal pain is there. Weight loss is there, and vomiting. These are the signs and symptoms are there, which are main yellowish in color. All the eyes and skin, pale stool, dark urine, pruritus, fatigue, abdominal pain, weight loss, vomiting. Okay, these are the signs and symptoms. Now, diagnosis. As usual, physical examination, they will see here what in detail we will going to see. Which are those one? Physical examination, liver functioning test, urine analysis, ultrasound, CT scan, cholecystography. We will see in detail this one, which type of graphy is there. Okay. MRI and endoscopic retrograde pancreatography, liver biopsy. Now one by one we will going to see physical examination. What we will going to see here exactly? The swelling of the legs, swelling of the ankles, feet, and also we will see the swelling of the liver, swelling of the liver. Due to these examination, the doctor can diagnose maybe there is a chances of jaundice. This is the all about the physical examination. And also in the physical examination, what the doctor will see, signs of an underlying condition, this also they will see. And by seeing the eye, skin, then also the understand, the doctor can diagnose this may be the case of jaundice, isn't it? By seeing the eyes, by seeing the skin yellowish in color, no? So that's why. And also the swelling of the legs, ankles, feet, and also the swelling of the liver. If we will palpate in the abdomen, so that's that time the doctor can understand due to swelling of this liver, there may be chances of jaundice. Now, liver function test. The liver function test helps to diagnose the liver conditions such as hepatitis, cirrhosis, alcoholic liver diseases, isn't it? When the liver is damaged, it releases the enzymes into the blood. And these levels of proteins began to fall. And due to this, we can see in the liver functioning test. So that's why the doctor can diagnose there may be the case of jaundice. Now, urine analysis, what they will find urine, first of all, the yellowish in color, and there is a presence of urobilinogen. Okay, urobilinogen, that is the this bilirubin is present in the urine. That's why the coloration is there. Actually, what is the normal urine contents of that urobilinogen? 0.1 to 1.8 milligram per dl. If it is high, then there may be chances of liver disease. This is we can indicate this when we can check by the urine analysis. Okay. Now next one, the ultrasound. Ultrasound, in this the painless imagining study is there. We will take the photographs, very useful for detecting the gallstones, dilated bile ducts. It can also be detect the abnormalities of the liver and pancreas in this ultrasound therapy. We will see in that one. Okay, sonography, ultrasound, isn't it? Directly we can examine the liver and gallbladder. Now CT scan, here also the similar, the photographs we will take here also imaginary study similar to X-ray that provides the details, more details here in the structure of all the abdominal organs. In this scan, all the photographies are there, isn't it? Slightly higher than that of the X-ray. It can identify the abnormalities of the liver, pancreas, and other abdominal organs. Okay, and this one, which is this one, cholecystography means what? Here we are using the radioactive substance to evaluate the gallbladder and the bile ducts, especially the gallbladder and the bile ducts. This is also called as HIDA scanning of this gallbladder and bile ducts. Okay, in the MRI, this is also the by using the magnetic field, we can take out the photographs more clearly. So that again in detail we will check out the bile ducts or other organs also we can check out by taking the photographs, more clear photographs in the endoscopic retrograde cholangiopancreatography. This graphy indicates this also endoscopic means what? Endoscope means what? A tube with a camera at the end. We are inserting into the mouth, into the small intestine, and we are taking the photographs. And along with this, we are giving the dye which is injected into the bile ducts, and we are taking the x-rays, means photographs. X-rays we will take, and clear cut idea about the stones, tumors, narrowing of, if any narrowing of the bile duct is there. That is, narrowing means what? Due to that narrowing, there is obstruction of the bile coming from the liver to the gallbladder or intestine. If there is any type of this, we can check out by this method. Okay. And biopsy, liver biopsy means what? A needle is inserted into the liver, whatever may be the biopsy. Cardiac biopsy is also there, kidney biopsy, any type of biopsy. Biopsy means what? In this therapy, a needle is inserted into the liver and a small sample of that tissue is obtained, and we have to examine if any damage is there, if any tumor is there, if any type of the benign tumor or something is there, we have to examine. And so according to that, we can diagnose the liver inflammation, cirrhosis, or any type of the cancer is there. We can see, examine in this liver biopsy. Okay, then how we will going to prevent that one. Due to alcohol, we all are knowing that due to alcohol, the liver will get damaged. This is the main cause. So avoid the heavy alcohol use. So that's why we can avoid the alcoholic hepatitis, cirrhosis, and pancreatitis. What are the treatment are there now? Supportive care, IV fluids in case of dehydration, medications for nausea, vomiting, and pain. If there is any pain or vomiting, for that medication we will give. Antibiotics for any type of the infection. Antiviral medications. If there is any antiviral infection is there, that time we will give the antiviral. Blood transfusion may be required for hemolytic anemia. If there is hemolytic anemia, we have to give the blood from outside, that we called as a blood transfusion. Okay. Steroids for the treatment of autoimmune disorders. Autoimmune disorders. Chemotherapy in case of the cancer, or rational therapy, we called as a right treatment. Okay. Phototherapy in the newborns. Okay, we will give here the the newborn babies we will keep in that box, isn't it? So this is the phototherapy. Jaundice caused by the drugs, medications, toxins requires the discontinuation of the offending agents, due to what the jaundice is there. So avoid that one drug. We have to stop taking of that drug, taking of that medications, isn't it? Alcohol cessation, stop the alcohol. Okay. And vaccines for hepatitis, vaccines are there. We have to take that type of the vaccines. Nowadays, corona vaccine we are taking like that. These vaccines are also available for hepatitis A, hepatitis B. All vaccinations are there. We have to vaccinate that one. Take the medication which prevents the malaria. If due to the malaria, if it is there, then take the medications to avoid the malaria before traveling to the high risk of regions. If any type of the you are traveling to some area, then you have to take the medications to prevent the malaria. Avoid the high risk of behaviors such as intravenous drug use or unprotected intercourse. That is for hepatitis B. Okay, avoid that one, all the risks. Avoid potentially contaminated food, water, and maintain the good hygiene. Don't eat roadsides. Don't eat the contaminated food. Don't have the contaminated water. Nowadays, distilleries are available. Avoid the medication that can causes the hemolysis. Some of the drugs, by these drugs, causes what? Hemolysis. So don't take that type of the drug which causes the hemolysis. Why the hemolysis is taking place? Because of deficiency of glucose-6 phosphate, isn't it? So avoid that one. Now see the complications. Cholangitis means what? Inflammation of the bile duct. There may be chances of other complications. The disease will be exaggerated. What it causes? Inflammation of the bile duct, that is called as a cholangitis. Biliary cirrhosis means a progressive disease of the liver that results into damage into small bile ducts that drain the bile from the liver. Where it will get drained? It will store into the gallbladder, or it comes into the intestine. Maybe chances of pancreatitis, renal failure, liver failure. These are the complications of this. This completes your jaundice. Are you understood this one? What we seen in this one? Jaundice means what? Due to hyperbilirubinemia, means due to the increase the levels of the bile pigments. Okay, bilirubin and biliverdin types: hemolytic, hepatic, and post-hepatic. Everything we will see in this one. hemolytic or prehepatic due to what? Due to breakdown of the hemoglobin that leads to causes increased production of bilirubin due to what? Malaria, sickle cell, spherocytosis, thalassemia, glucose 6 phosphate, drugs or other toxins, autoimmune disorders. Second one, that is the hepatocellular, or it is also called as a hepatic jaundice due to damage or dysfunctioning of the liver. That is due to hepatitis, cirrhosis, drugs, due to Crigler-Najjar syndrome, which is due to hyperbilirubinemia in the high production of high levels of toxic substance, that is bilirubin, in the blood, and due to the Gibbert syndrome, means what? Genetic liver disorder, or due to the cancer. Third one, obstructive jaundice, that is the post-hepatic jaundice, means what? Any obstructions is there in the bile duct, then may be chances to produce the post-hepatic jaundice. What are the causes? Due to the gallstones. If it is there, the gallstones, due to that stone, the bile will not come from the liver to the gallbladder, isn't it? Due to that stone. Cancer, any type of this pancreatic or gallbladder or bile duct carcinoma, there may be chances. These are the main causes for this post-hepatic jaundice. Pancreatitis, parasites, due to parasites, due to pregnancy, newborn jaundice. What are the signs and symptoms of the jaundice? Yellowish eyes, yellowish skin, pale stool, dark urine, yellowish in color, pruritus, that is the itching, fatigue, weakness, abdominal pain, weight loss, vomiting. Okay, diagnosis, physical examination, what they will check here? By seeing only the patient, the doctor can diagnose what? The yellowish eyes, skin, isn't it? And by palpating the liver. Okay. Liver function test, urine analysis, ultrasound, that is the sonography, CT scan, cholecystography. It is also called as HIDA scanning, MRI, okay, liver biopsy, endoscopy. These are all about the diagnosis and what treatment actually we have to give according to the supportive care, okay. And IV fluids in case of dehydration, antibiotics, antiviral medications. If hemolysis is there, give the blood. Steroids for the treatment of autoimmune disorders. Chemotherapy or rational therapy in the cancer. Phototherapy for the newborns. Okay. Alcohol, if it is due to the alcohol, stop the alcohol. Vaccines for the hepatitis, and take the medications to avoid the malaria. And the complications, which will be the complications? Inflammation of the bile duct, that is cholangitis, pancreatitis, renal failure, and liver failure. So that's why we completed this jaundice. Okay, are you understood this one?
Yes.
Yes, ma'am.
Now we will stop here only.